4 early ovarian cancer symptoms every woman should be aware of. Cancer is one of the world's major causes of death. For many years, doctors and researchers have worked around the clock to discover therapies for all types of cancer. We are still learning about this terrible illness, and because there is no treatment, we must keep an eye out for indications and symptoms that might lead to a diagnosis. Take ovarian cancer, for example. According to data, Canada had 2,800 occurrences of this illness in 2016 and 1,750 fatalities. In 2016, the United States predicted 22,280 new cases and 14,240 fatalities. The reason for such a high mortality toll is that this malignancy is very difficult to identify. Presently, there is no test available to identify it, and the symptoms are often misdiagnosed as other conditions. However, a recent study has shown intriguing indications and symptoms of early ovarian cancer. That being said, don't forget to subscribe to our channel for more daily tips like this one, and switch on alerts, so you never miss out on new videos. Before I go into the early signs and symptoms of ovarian cancer, here's some background on the condition. There are 3 forms of ovarian cancer. The first are epithelial tumors, which begin on tissue outside the ovaries. Nearly 90% of ovarian cancer patients are epithelial tumors. Then there are stromal tumors, which form in the ovarian tissue and are responsible for producing hormone cells. These tumors are detected in their early stages, and stromal tumors account for around 7% of all ovarian tumors. Germ cell tumors are the final kind. They begin in the egg-producing cells. This form of tumor is more common in younger women. It's critical to understand the risk factors for ovarian cancer and the many stages and treatment choices accessible to women. Understanding more about ovarian cancer will help you know what to look for if you are concerned that you may be at risk for the disease. Factors of risk. Let's start with the risk factors for ovarian cancer. Specific risk factors must be considered when discussing ovarian cancer, just like any other illness. Consider your age. Anybody may be diagnosed with ovarian cancer, but those between 50 and 60 are at a greater risk. It is also possible to pass on the gene mutation that causes it. Breast cancer gene 1 and breast cancer gene 2 are the genes involved. Being overweight or obese is another risk factor for ovarian cancer. Obese women may be at a greater risk of acquiring ovarian cancer, and obesity may also influence a woman's chances of surviving if she already has ovarian cancer. This reason is why, if you are obese or overweight, you should see your doctor. Find out how you may alter your lifestyle to minimize your chance of getting ovarian cancer and other forms of cancer. According to research, women with children beyond 35 are more likely to acquire ovarian cancer. At the same time, other studies show that women who use hormone treatment after menopause may be more likely to develop ovarian cancer. Women who take estrogen without progesterone have a higher risk of developing ovarian cancer than women who take estrogen and progesterone. Diagnosis. As previously said, no test can detect ovarian cancer, but other tests may assist physicians in making a choice. The first test is an imaging scan of the pelvis and abdomen, involving an ultrasound or CT scan. These 2 tests may assist in determining the size and form of a woman's ovaries. The second test is a blood test that may identify a protein that is often detected in instances of ovarian cancer. Ovarian cancer stages. Ovarian cancer has 4 phases. When ovarian cancer is in its early stages, it is discovered in one or both ovaries. Stage 2 cancer is when it has spread to other parts of the pelvis. Cancer has progressed to the abdomen in stage 3. Cancer has gone to the ultimate stage when discovered outside the core. Treatment. For women who have been diagnosed with ovarian cancer, there are a variety of treatment choices available. The stage of her disease determines the sort of therapy a woman gets. Local treatments for ovarian cancer include those that target the tumor. This reason might entail tumor removal surgery or possibly radiation treatment. On the other hand, systemic therapy reaches cancer cells situated throughout the body. This sort of therapy is administered in medications, either orally or injected into the circulation. Chemotherapy, hormone therapy, and targeted therapy and medication treatments for ovarian cancer. Treatment options differ depending on the kind of ovarian cancer and the stage of cancer in which a woman is diagnosed. The majority of women diagnosed with ovarian cancer have surgery to remove the tumor, with various kinds of therapy varying depending on the stage of the disease. Consult your doctor immediately for additional information about ovarian cancer therapy. Let's look at the most prevalent early indicators of ovarian cancer. Here are 4 early signs of ovarian cancer that every woman should know. 1. Prolonged bloating. If you have unusually persistent bloating that lasts 3 weeks or more, this might be an indication of ovarian cancer. In this circumstance, the best thing to do is speak with your doctor to acquire a correct diagnosis. If you have unusual bloating that lasts more than 3 weeks, consult your doctor to rule out the possibility of ovarian cancer or any other type of cancer, especially if you are over the age of 50 or if you have a family history of breast or ovarian cancer, which can put you at a higher risk of developing those types of cancer. 2. Pelvic or lower abdominal pain. During menstruation, it is usual for women to have discomfort in their stomach, pelvic, and abdomen. However, if the discomfort persists after the lady has finished menstruating, it might indicate ovarian cancer. This symptom is especially essential for women, since it is sometimes misinterpreted as period pain. It is necessary to see a doctor if you have any strange pains in your pelvis or lower abdomen or feel exhausted in your legs. Excessive weariness is another sign of ovarian cancer and discomfort in the pelvic or lower abdomen. Monitor your body if you feel particularly tired or weak, or if your body and muscles do not feel as strong as they used to. If this persists for many weeks, you should see your doctor. Make sure to discuss any other unexpected health conditions or symptoms you're having. 3. Eating disorders. If you see yourself growing less hungry over 3 weeks, you should see your doctor. It might be a problem with your stomach or intestines, but it could also be an indication of ovarian cancer, so don't take any chances. Aside from losing your appetite, another typical ovarian cancer symptom is a persistent sense of being full, accelerated weight loss, or abnormal weight gain. Aside from these eating problems, you may also have heartburn and gastrointestinal disorders such as burping. Other ovarian cancer symptoms or indicators include constipation, diarrhea, nausea, gas, and heartburn. If you are having problems with weight loss or gain, or observed strange or unpleasant stomach concerns, see your doctor right away to rule out the chance of ovarian cancer. 4. Urgent urinary need. If you find yourself continuously racing to the toilet to pee and you haven't changed your liquid intake, this might be an early indicator of ovarian cancer. Also, if you feel okay 1 minute and then need to use the restroom 2 minutes later, it might be a bladder infection or ovarian cancer. A wide range of symptoms characterizes ovarian cancer. With ovarian cancer, severe exhaustion, trouble eating, discomfort during intercourse, unexpected vaginal bleeding, unexplained weight gain, and other symptoms are prevalent. If you observe any of these symptoms, or any of the symptoms described in this video, contact your doctor right once to rule out any health illnesses or difficulties. You should also consume a nutrient-rich diet and include some exercise into your daily routine, and see your doctor regularly to keep your health in excellent condition. What additional early indicators of ovarian cancer are you aware of that were not covered in this video? Please let us know by leaving a comment below. Did you like this video? Please like and subscribe to our channel to see more videos like this. Thank you for tuning in.
Music licensing reimagined. Artlist.io